I truly love just the bond, the relationships that you make with patients. I love the fact that a patient can come to you in pain or hurting in possibly one of the most challenging seasons of their life, and you can help get them past that.
As a physical therapist, our treatment and our scope of treatments that we can provide is very broad. We treat in general musculoskeletal pain, so that would be your joint pain or your muscle pain, and then we can treat with a number of different modalities. We can help with the pain and the inflammation using machines and various applications with either electrical stimulation or ultrasound. But I think the crux of what we do comes with our exercise and manual therapy, and research supports that across the board. So we do, as a PT, I do a lot of manual therapy with my patients, such as joint mobilization or manipulation if it's appropriate. I do a lot of soft tissue work, a lot of cupping, what's called IASTM or instrument assisted soft tissue mobilization. I do dry needling, and then I also will then follow that up always with exercise and individualized exercise programs that are important to that patient and address their specific needs to get them back to their best functional level as possible.
So primarily here at Logan County, I work in the hospital setting. So that is acute and swing bed care. And that is primarily with people 65 plus. A lot of times, the diagnosis can vary. Post-op care, just weakness due to general illness that puts them into the hospital. So we do a lot of functional activity, get the people back home, work them in the community so that way when they discharge from the hospital, they are set up for success, whether that be at home or in an assisted living, a nursing home, at home with family. We try to make everything as functional as possible so that way when they get home, they don't have to return.
A lot of times patients are fearful, patients are nervous about being in here. So a lot of it is connecting with the patient, forming that bond, letting the patient trust you. Like in terms of a shoulder, we do a lot of joint oscillations. So after you would massage the patient, you just simply rock their arm. You move their arm in order to get them to relax before you start moving. So a lot of it is patient trust.
Every day is going to be different, and that is one of the reasons why I truly enjoy it. It's a problem-solving job. I love problem solving. Every patient, again, comes in there different. They present differently. Some patients follow textbook patterns. Most patients do not. So if they're missing this piece of the puzzle, then what can I do, again, to make it individualized and to make sure that it meets that patient's needs in order to see that they can meet those goals and decrease their pain and get back to their functional things.
It is challenging. Like I said, you never know what you're going to walk into day by day, but at the same time, it is so rewarding. You see your patients progress, you see families excited that the patient is progressing after an illness that they weren't expecting. It is very rewarding.
I got a degree in health promotion and wellness, and it's a very broad degree. I did an internship at the Center for Health Improvement in Hayes. So again, very broad, working in a gym-like setting. My last semester at Fort Hayes, there was a girl that had expressed interest in going into the physical therapist assistant program, which piqued my interest, led me to apply there. And so that is ultimately where I ended up with 3 other of my classmates that also went into the same health promotion and wellness field.
So I attended Kansas State University and got a 4-year bachelor degree in kinesiology, and that left things very broad for me. I applied to the PTA program and got accepted, and it just felt like a good fit. And I knew I could work with many different people, many different settings, many different levels, and so that's why I chose that.
The education or schooling required to be a physical therapist requires that you undergo a 4-year undergrad degree. I chose my degree in athletic training. Some people will follow maybe a kinesiology path or just a biology path. Once that you have that undergrad degree, you can apply to go to PT school. Most physical therapy programs are 3 to 4 years in length, and they do include the clinical portion of the program within the content. So your clinical experiences are usually included in that program. After you graduate from physical therapy school, you will graduate with your Doctor of Physical Therapy, and then you are able to sit for your national board and become licensed.
It's a wonderful career. It offers challenges every day, but good challenges, but it's also very rewarding.
I would highly encourage a career in physical therapy. I feel like it has the ability to stay active all day. You don't sit all day or stand all day. You're constantly in motion. You're encouraging others to be active. And also it's changing every hour or every half hour that you have a patient. You see a whole new diagnosis. You work with an entire different person, different personality, different problem. And then you're constantly working as a team with the physical therapist. And so it's a really great environment.
If you like people, if you like to help people, if you like to problem solve, this is definitely a career path that would suit you. I think at the end of it all, if a patient's here for 12 weeks doing rehab for rotator cuff repair, a lot of times they get a lot of hugs just because we have established a relationship, and then again, living in a smaller community, see them out on the street, and it's just nice to know that you helped them out and that they were receptive to the care that you provided them.
My name is Samantha Teeter, and I am a PTA.
My name is Sarah Samuelson, and I'm a PTA.
My name is Holly Kuhlman, and I am a physical therapist.